My name is Paul Barron. I'm a surgical oncologist. I've been in practice for close to 30 years. My focus is to identify patients who have an increased risk for getting cancer and gives them options for early detection and prevention of breast cancer. As a breast surgeon, it's very important to me to know whether a patient carries a gene mutation that increases their risk for breast cancer. You lower the risk of developing future breast cancers. It helps their family because then they will know if they have an increased risk for cancer. And so you can institute measures for early detection, prophylactic surgery, and chemo prevention to lower the risk of developing cancer. We always want to do the best we can for our patients. We want to have the best outcomes. We want to have the best results. So similarly, when we send a test, I want to make sure it's the best test. My first preference is always to use Myraid if I can. It's very important to me that when I send the test out to a lab, I have a lab that I have a lot of confidence in. One of the beauties of Myriad Genetics is they've been doing this for so long and they curate the data so well that you're less likely to get a VUS. 42 to 63% of the time, they actually are classified by Myriad as either a deleterious mutation or not. With the myRisk report now, these are unaffected patients. We get what's called a risk score, and that is, it gives you an idea of what is that patient's risk of developing breast cancer. It's very helpful for the unaffected patients to see if they qualify for an MRI. So if that risk is over 20%, then inevitably the insurance company will approve them to have an MRI to screen for cancer at an early age. They have a very strong financial assistance program for patients. If it meet guidelines, 75% of the patients out of pocket is zero. If they meet guidelines, 90% of the patients, it's less than $100. I've just found Myriad to be very helpful over the years. They're always there as a resource, and most importantly, they're always there for the patient. And that's obviously their main focus.